Imagine this, you're dropping off your first year freshman to college at a university, dropping them off on campus, and you get a call from your neighbor, the neighbor of your mom back home, saying that your mom is wandering. What do you do? Like that call alone is super stressful. But this happens a lot to so many families, so many people throughout the nation dealing with loved ones who have dementia. What do you do? In this live, what we're going to do today is we're going to walk you through all the care options that you can think of or even understand when it comes to caring for your loved one with dementia. We're going to walk through a couple scenarios, specifically a patient scenario that we've maybe taken care of over the years, so that you can put yourself into their shoes and understand all the things that you need to have the knowledge, to have the understanding so you can make good decisions when that time does come for care for your loved one. So let's walk through this together. All right. What's going on, Charlotte family? Hope you guys are doing well. Welcome to another live where we talk about senior care and healthcare at home. I'm going to actually bring in JT, our executive director here, where we do these weekly. What's up, JT?
What's up, Charles? Good afternoon.
Good afternoon.
Tuesday.
Happy Tuesday. It's lunchtime. So for those of you who are hopping on and watching us during your lunch, eating and enjoying, we appreciate you. Yeah, JT, how's your week going so far?
Good. I don't have any kids, so I'm not getting caught up in the back to school, but I'm dealing with the school zones
Yeah,
and everybody else that's got them. So how
that's all
about
right.
you?
People, you should have. I would have not known. I thought you were 45, man.
Right.
We always joke around.
I get that a lot.
Oh, that's awesome. Well, like we said, thanks for hopping on, everybody. This month we're focusing on education on dementia. What we've been doing over the last several months is really walking families through hospice education. But the services that we provide are home health, hospice, personal care, and veteran care services, a lot of care services at home. And so we're trying to really make this simple and palpable for everyone to understand the options of care at home. And JT, we have these questions from families like all the time about care options.
Yeah. And a lot of the questions are like, who's paying for it? How often are they going to be there? How many hours a day, days a week? Who are these people? Are they nurses? Are they therapists? Are they caregivers? Are they trained? All those things. And so we'll kind of get into it. We're gonna talk about Miss Ellie and kind of walk through. We've done this all year where we've taken a patient that we've served over the years, maybe change their name or their gender or something to protect their privacy, but also use a real scenario to say, okay, this is your loved one. Thank you for hopping on today, whether you are in this scenario or you just wanted to hop on and learn more about healthcare, but really to understand what options are available to families at home.
Yeah, no, 100%. So to get it kicked off, we're going to walk through some statistics. Why are all these things important for family members? And JT, can you kind of walk us through the stats of like how prevalent is this information for families and how
Yeah.
much they need to know?
Yeah, we hear about the aging population, or some call it the silver tsunami,
Yeah,
but there's a few factors, of course, with people living longer. There's going to be a greater need for senior care, and so we know in the U.S. 1 in 5 people will be over the age of 65 by 2030, but here in Plano, where we are in Charlotte, 1 in 2 people will be over 65 by 2030, and so what we are trying to do, and people in our industry are trying to do, is to educate people ahead of time, so that, because 90% of adults want to age in place, whether that's at home or in a assisted living facility or in their son-in-law's home or wherever it is that they want to be in place. How can you, as the decision maker or the medical power of attorney, or the caring son or daughter of your parents, how can you help them reach that goal?
Yeah, 100%. And I think a lot of times, we don't realize that this not just for, you know, caring for your loved one, but also there's an industry where there's going to be such a big need for those who are interested in coming into this realm, being a nurse, being a physical therapist, being an aide, right? There's such a big need. And I think it's about making sure that if you're looking to go into this industry, that you have the heart for it. We talk about that a lot. JT is you have all these loved ones who need good care. And these are the kind of the pyramids that we kind of talk about a little bit when it comes to care at home. If you've got home health, you've got personal care, you've got palliative care, you got hospice care. And I think a lot of times when families need it, they get bombarded with a whole bunch of information, and it's hard for you to like digest that and understand it. And so what we're going to do today is walk you kind of through Miss Ellie's scenario and her story, and what it is. And so if you look at this pyramid, this is what we'll talk about today. And so enjoy it. Take some notes if you want, or instead of taking notes, just go back to our YouTube channel and then replay it again. It's just good information, and I hope this serves you. So hope this serves you and everyone else. So, but yeah, JT, Ellie. This is Ellie. Real stories retold. We're going to talk about Miss Eleanor and her life specifically. But this month we're talking about dementia, and so we wanted to kind of highlight. Every month we highlight a clinical aspect or clinical diagnosis. There's so many diagnoses, but this month, we're talking about dementia. And when you think about dementia specifically, it's a general decline, right, of your memory, of thinking, decision making. It's not just randomly forgetting something. Sometimes we forget things, and it can't be dementia because you just forgot something, right? It is a progressive forgetfulness, and so it may increase to the point where your loved one may need help with bathing, help with dressing, help with eating, making sure that they're taking their medications timely, mobility, safety, and then extra assistance. And so, 1 in 9 Americans actually suffer with Alzheimer's or dementia over the age of 65, which is a big thing. And JT, we see this a lot.
Yeah,
Yeah,
yeah, we have this diagnosis comes across, for, like Charles said, there's a range of it that it affects families and patients, and some people need a lot of assistance with it, um, such as being in a memory care facility or somewhere where they're getting that 24/7 supervision in a way. Others just more need someone to like go check in on their mom or dad, make sure they took their meds or they didn't miss a doctor's appointment. And so that's where we introduced Miss Ellie, and where kind of her family came into the picture as far as healthcare at home goes.
yeah, 100%. Yeah. And so Miss Ellie, we'll talk about Miss Ellie, Miss Eleanor. She was a seamstress. She loved sewing for her kids, for loved ones that she knew, with her husband, two daughters. And so, unfortunately, her husband passed away, and she stayed in that house for 50 years. And she did pretty good over the years, but over the time, she began to forget things, right? And that happens to a lot of loved ones. Left groceries on the counter. Our daughters came in and realized, wow, the stove is still on. Like, this is not good, right? Like, what she used to do very simply and easily, those routines, she began to forget them, and uh, wound up meeting with a neurologist, and the neurologist actually, diagnosed her with Alzheimer's dementia specifically. And that's where, their daughters are like, well, what care options do I have? Like, what can I do? Or, what's something that needs to get done? And that's where the first pillar that we've kind of talked about in this situation would be personal care services. And so when it comes to personal care services, they were figuring out, okay, we need to have someone to be with mom, right? To be with her a couple times a week. But we have to pay somebody because insurance is not going to cover this aspect of what mom needs. It's just small little things. And so, she did that and they did that. And so, JT, when we look at personal care, can you kind of walk us through like what is it and what does it entail?
Yeah, when I think about when we met with Ellie's daughters, they're in this home, and it's a beautiful house here in Plano. Has view out of the back of the house, and mom's goal was that she didn't want to leave that home. And so I went out with our social worker, shout out Miss
Mhm.
Terry, and we went out and said, okay, well, based on how she's doing, her diagnosis, we wouldn't recommend she lives here by herself. And that's where the daughter shared, well, this is, the home she's lived in for 50 years. It reminds her of her husband. And so that's where we introduced personal care. And so personal care is that non-skilled daily assistance that can be done at home. So help with ADLs, activities of daily living, such as bathing, dressing, grooming, having companionship. uh, Specifically for this one, they showed us the frozen drawer in the freezer of
Hmm.
all the meals that they purchased on. They'd come and shop groceries for her every week, and so meal preparation. We don't have scratch chefs, on the personal care side, but they do meal prep like that, and then housekeeping, changing linens, doing laundry, and bringing Miss Ellie back and forth to her doctor's appointments. All of these things can be done by a personal caregiver, and that caregiver is either a CNA, a certified nursing assistant, or a trained caregiver
Hmm.
who has learned how to do these things with some sort of supervision outside of just the basic life skills and conversation
Mhm.
skills. And so, of course, an important question is who's paying for this.
Yeah.
And so it's usually paid, most commonly private pay, out of pocket, cash based, at an hourly rate that the agency sets. Sometimes it can be covered by long term care insurance. So there's a bunch of them out there, but like New York Life or John Hancock, if
Mhm.
you reach out to your long term care insurance provider, you can ask if personal care or home care or aid services, it has a lot of names, are
Mhm.
covered. And then another important one we always like to mention is for our veterans. The VA actually has a homemaker aid services program. And so when you go out and get set up at the VA, the doctor can order a personal care aide to come out to the home several hours a week.
Mhm. Yeah, it's such a big help. I think a lot, especially for veterans too. We talk about that a lot. Is veterans have served their country, and now this benefit is there. But sometimes it gets a little bit difficult to kind of walk through
Hmm.
that whole process. And so, what we've seen over the years is that the best personal care companies, what they do is they'll kind of walk the veteran through everything. Walk the veteran, say, okay, this is the form that needs to be signed. This the your medical power of attorney or your next of kin can help you go through this. And I think that helps the veterans a lot. And so in this situation, Miss Ellie wasn't a veteran, but we see that a lot as well. And kind of JT, we talk about this too, is like, we're in the state of Texas. So specifically, there's different states may have different rules and regulations. But if you're in Texas, this information we're giving you is for our area, Texas and Dallas. But some areas may differ when it comes to VA services or when it comes to insurance as well. So, but yeah, 100%. So now as we kind of move forward and she went through and got personal care services, she was needing more help from a strength side, right? She was getting a little bit weaker based off of her dementia. And the caregivers were saying, we can only do so much because they're not clinical, right? And that's another thing we've talked about too, is that the caregivers are trained. Sometimes they're CNAs and they have years of experience when it comes to dealing with seniors. But the next step is having that nurse, someone, or a therapist or occupational, and that's where we see home health. So this is where, in this situation, the neurologist or her PCP would order home health services, and that's how we got involved from the home health side for Miss Ellie. And so once home health is initiated and started, she's able to get those type of services. If you don't mind, JT, let's walk through home health for Ellie and what does it look like? Who are the payers and those services that she may get?
Yeah. Yeah. No, that's a great question. So for home health, that's where, like Charles said, the personal care has been in there. She's staying cleaner, hygiene's better, meals are being prepared on time. But now there's several different pill bottles because the neurologist and the PCP, and the cardiologist, whatever all the doctors are, there's these different bottles. There's an organizer that is followed when the caregiver is there, and sometimes it's not. And so how do we get that organized? And then on the other side, like you said, strength wise, she's having a little more trouble doing things on her own or standing up or walking. And so now you can reach out to that neurologist or reach out to that primary care physician and say, I think my mom, or maybe they might hopefully refer it to
Mhm.
hers, but they might say, she would benefit from some help with her medication management, with strengthening exercises, with exercises that'll help with the ADLs. And so um, those things are available under Medicare or under commercial insurance, depending on the home health benefit, where someone that is homebound, so not bedbound or
Mhm.
chairbound, but it takes a reasonably taxing effort for them to leave the house. If they're homebound, have that skilled need like Miss Ellie does, we're talking about it, and then the doctor writes that order, they can actually initiate home health care. And so that's a nurse, PT, OT, even speech therapy, social work. A home health aide is similar to the personal care aide, but it's not as long of a shift and it's not as frequent.
Yeah.
It's more to just support the nurse with some of the plans that they have put in place. But all of these folks can come in um, underneath that doctor's order and underneath Medicare.
Nice, nice. JT, once home health starts, like how long usually does that last, or what do we usually see when it comes to home health?
Yeah, yeah. So it goes in 60-day episodes, and so each 60 days, the nurse and the physical therapist and everyone else involved is gonna sit down together and say, all right, this is the plan for these 60 days. These are our patient's goals. These are our clinical goals. Let's try to meet them. If they get to the end of the period and there's been progress, but not enough to say like, all right, we don't need this anymore. The team can actually recertify the patient for another 60 days, and so
Mm,
some patients are with us, 100 days or so. Some are with us for an entire year because, if there happens to be a fall in that period, or a new medication is introduced by the doctor and there's new symptoms, we're going to stay there and kind of monitor and help work through those.
yeah, 100%. Yeah, and I think it's a big layer of that support for Ellie's daughters, right? So when we think about, her being at home by herself, she's got personal care services a couple hours a week in between the times when you have the home health team there. Having that in home health team to then relay the clinical needs to their daughters and be that buffer between the doctor, right, and the clinical team is such a big help. And I think
Mhm.
the best home health, what they do is they'll have a main RN who's kind of overseeing the team as a case manager and coordinate with the PTs that may be coming in, or the LVNs that may be coming in, or the OTs, and really coordinate to, number one, keep Ellie safe at home, to not allow her to go back to the hospital, and keep her to where she can continue to progress with her disease as much as possible. And so it's such a great benefit.
Mhm.
If you pick the right one and you coordinate with the right one, it's such a big help for families. So in this case, Miss Ellie did home health and did, was doing pretty good. But then it got to the point where she had another fall, right? She went to the ER and she became more confused, and her dementia began to progress more. And it got to the point now where, in this situation, when we're looking at the pyramid of care that we've talked about before, is, had home health, right? Personal care and home health together to keep her safe, good at home, continue to enjoy her life and do everything that she could do. We get to the next layer, which is palliative care and hospice care, right? And so in this situation, um, her quality of life was the biggest thing that her daughters were looking at. 91 years old, sleeping a lot more, eating very little, and requiring more help. The biggest thing in this situation that we saw was that, the goal was to keep her at home, and to keep, you know, the memories of everything at home, and that's what their goal was to be at home. And I think in this situation, they decided to then, with the doctor's guidance, you may consider hospice services. And now, you know, I think a lot of times when you hear the word hospice, it's like, whoa, like, JT, it's like a movie theater, someone's gonna die right away. And I think a lot of the times that what we've done over the last 20 something years is that it's not meant to be that. If you're able to understand the benefit of hospice and the goal and the wishes of your loved one, they can align very well, and it can be done to support your family and Ellie's family and everything. And that's what happened, in this situation is that, they decided to move forward with hospice care. And JT, can you kind of give us we've been doing it a lot over the last couple months, the hospice 101s, but, can you kind of walk us through a little bit of, what does this hospice look like for Ellie and her daughters?
Yeah. No, yeah, and hospice, it's a scary word, and you think back to, like, old movies and TV shows, it's a dark room and it's, a very quick process,
Yeah.
but actually hospice, especially for someone with dementia, because we don't know. Doctors have their clinical judgment, but the signs of decline with dementia can be a little harder to predict than some of the other terminal illnesses. And so, um, like Charles said, the goals change from looking for improvement in strength to staying out of the hospital,
Yeah.
managing pain and symptoms, um, you know, talking about nutrition, things like that. And so, hospice comes in similar to the way home health does. The doctor orders it, but now there's a nurse who's kind of the quarterback of the team, and this nurse is going to do a full assessment at that first visit and understand, all right, we know you've had personal care over the years and home health. What have you liked about that team, the way they communicate with your family, the way they, treat your mom. Um, okay, this is what we're going to do from hospice. We're going to manage medications in a similar way. We're going to treat, anything that comes up on the skin, any pain symptoms. And so there's a physician that oversees all of that. But the CNA, the aide, is now maybe there a little more frequently under the nurse, helping with some of the showers or hygiene. And then from a spiritual side, or emotional side, there's the social worker and the chaplain,
Mm,
and those two are not as involved on the home health team. But with hospice, since it is dealing with end of life, it's important for both the patient and the family to be able to talk about those things,
yeah.
talk about end of life arrangements. And so that's the team. Again, the nurse is kind of the captain of that team. On the other side, though, there's also a lot of other benefits because it falls under Part A of Medicare versus Part B. And what that means is we're going to try to emulate, a hospital at home, some people call it. And
Hmm.
so medications will be delivered to the house, medical equipment like a bed, hospital bed, wheelchair, walker, lifts, all of that will be brought to the house. And then hospice is available 24/7 as well. And so if anything comes up in the middle of the night, on a weekend, generally you'd call your neurologist, call your PCP, you know, please leave a message, call during business
Yeah.
hours. With hospice, there's 24/7 on call support. And then another thing I forgot to mention is supplies as well.
Hmm. Yep.
Um, you know, incontinence care supplies, bed pads, chucks, wipes, gloves, all these little things that your family's worrying about, running to Walmart, picking it
Yeah.
up, paying for it. Your nurse is going to monitor those things in your aid to say, all right, let's keep everything at home. Let's keep everybody comfortable here.
Yeah,
So,
yeah, 100%. Yeah. I think the biggest thing when we look at hospice, when we look at the word hospice, we just think about support. And I
mhm,
think Medicare made this to really support families and patients that qualify clinically. So in Ellie's standpoint, specifically her disease, dementia, there's these specific guidelines, they call them LCDs, that really paint the picture to see whether or not she would qualify for hospice. And that doctor who wrote the order was saying, I think it may be time to consider it. So then the hospice, what they do is they'll go over those clinicals and make sure that they do qualify. And if they do, then all of these benefits are able to now help Ellie and her daughters through this tough time, and be there. And, that's where we kind of see 6 months or less to live is the guidelines for hospice services. But a lot of times, once that 6 months is up, there is a recertification process that's done where the hospice nurse practitioner and the hospice team will say, does Miss Ellie continue to qualify based on all of these guidelines for her diagnosis? And if she does, then she can continue to get the benefit of hospice services because only God knows when someone will pass. Hospice is there to support families and guide them through this terminal end stage of life, and it's a beautiful thing. Beautiful thing. JT, who pays for hospice service? We talked about Medicare, but is it? What if it's like someone who's younger than 65? How does that work?
Yeah. Yeah, it's a great question. So for anyone that's has Medicare and is over the age of 65 or has Medicare for, another reason younger than 65, it's covered by Part A. So that same level that covers hospital stays, rehab stays. Um, but for someone that's under 65, if they have Blue Cross Blue Shield or United Healthcare commercial insurance plan, we always recommend you reach out to your insurance company directly and find out, do you have a hospice benefit? And if not, there is an option to still get these services paid privately, if needed at this time. And so I always like to tell Charles, like when patients hear all of these things, their families hear all of these things, what they were like, whoa, who's paying for all this? And I
Uh,
say, you've been paying into it your whole life with Medicare. That's the benefit that's been created for you.
yeah,
Um, so
yeah,
yeah,
hundred
good
percent.
question.
No, 100%. And I think as we look at, the pyramids again for Miss Ellie, we talked about, her being on home health, right? And then utilizing personal care services for the gaps in between her care, right? So now once hospice starts, home health goes away, right? And so now she's utilizing hospice services, but hospice isn't there 24/7 at the bedside, right? It is there 24/7 support clinically. And so in these situations with Ellie, with her goal being at home, they continued to have personal care services for those hours where the clinical team is not there because her desire was to be at home. There's other families where we talk about where they go to like a group home or they go to an assisted living facility. And then hospice is that clinical layer that sits over their care and then coordinates that with the family. And so it is a beautiful team aspect, right, to help in this tough time where we're looking at a terminal diagnosis and end of life. And we kind of hearken it to the support that you get when a baby is about to be born, right? You get a whole team, so much people around to help with that whole process. It's the same when you look at hospice, right? Once you get towards the very, very end, then everyone kind of wraps around, right?
Mhm.
Just like a birth, right? Everyone comes around to really make sure, okay, is everything okay? Is the loved one taken care of effectively and efficiently, and is there supplies, medications, and that's really, really what it mimics. And we look at Ellie's life, what she had gone through with the love of her life with her husband and her two kids, and she's now at home, with seeing her grandkids coming in and having that personal care support, having that hospice support until she does pass. And I think when you're looking at the whole picture of the care at home that we talk about, these are the things that are available, to families when it comes to care at home as a whole. So,
Yeah.
JT,
And then
yeah, go ahead.
yeah, I just gotta jump in. It looks like Shy on YouTube left a comment. He
Mhm.
said, and he brings up a good point. He said, without testing, lab testing, don't give any prescriptions. As far as doctors go, patients are tired and other problems are
Mm,
created. That's a great point. So for all of these things that we do, personal care, home health, hospice, none of the prescriptions or medications that are being used are not, overseen by a doctor that
yeah, yeah,
has had them either in clinic or done a home visit
right,
or, a nurse practitioner that goes out and sees those things. And so, yeah, if there's no clinical oversight for these things,
yeah.
it opens a whole
It
can of
does.
worms.
It does. Yeah, that's why we always say, like, we always recommend the best home health or the best hospices, the best personal care services. They follow these, conditions of participation, which are in compliance with what needs to be done for the families. And
Mhm.
don't just go with any home health or any hospice or any personal care company because they need to be in line so that your safety of your loved one is the utmost priority. Yeah, that's a great point. Great point,
Yeah.
Shot. Um,
Sweet.
yeah, awesome.
Yeah, and as we get back into school, talk about the sandwich generation. I'm not in it.
Yeah.
I know Charles is. You have
Hey,
older
man, I'm
parents.
still
You
20. I'm still 20.
But when you're in this generation that is sandwiched between, dealing with little ones, dealing with older parents, and then you also have your own job and your own bills and all those things.
Mm,
It's just good to have these conversations ahead
yeah,
of time too.
yeah,
We'll get calls to the office, be like, my mom's doing good, but like,
yeah,
if anything happens, like, what do
yeah,
I need to know? And that's what
yeah,
we're here for. And so,
yeah,
if you want to talk about any of these services, you can either call us at this number,
yep,
or go to charlin.org, charlin.org. We have a lot of education on there. Find us on YouTube, LinkedIn, Facebook, wherever you're joining us from. But we appreciate y'all hopping
yeah,
on today.
yeah. Looking forward to seeing you guys. We'll do this once a week as we have been, maybe on a Tuesday, maybe on a Wednesday. We're in healthcare, so we're always busy and running, ripping and running. So we hope this helps you guys. Yeah, we'll see you guys next time. God
Sweet.
bless.
Appreciate y'all.
See you.